Alrighty. So, yes, just please be seated. And thank you for attending the presentation of Your Heart and Brain Prevention Matters. And we're going to be having a presentation by Dr. Leanne Wills, who is a graduate from the University of Western Ontario and moved to British Columbia and spent 35 years in family practice in West Vancouver and is now redefined and is now doing locum, very active in the division of family practice in North Van on the North Shore here. And we're absolutely delighted to have her do our keynote presentation today on the importance of knowing where you stand as far as cardiovascular protection is concerned. And what is good for the heart is also good for the brain, okay? One of the problems we have with aging is the whole issue of rusty pipes. And rusty pipes lead to heart attacks and strokes. And so what we're going to do this morning is to learn about those strategies as to how we can actually prevent that progression and possibly even arrest it and maybe improve it. So without any further delay, Dr. Wills, thank you.
Thanks, here. Got clicker in one hand, microphone in the other. Thank you so much for coming today, and hopefully you'll enjoy this talk about cardiovascular disease. I'm going to just talk a little bit about what cardiovascular disease is. Hypertension, diabetes, cholesterol, some of the contributing factors to developing cardiovascular disease. And then we'll have a little summary. Hopefully there'll be some take-home messages, that things that you learn or that you hadn't heard before. And also there will be a summary sheet with some resources. There's some printed copies at the back, so you don't have to write everything down. There will be some stuff. It'll be at the table at the back there. So what is cardiovascular disease? Cardio, heart, vascular, blood vessels. So in general terms, a group of diseases of the heart and blood vessels. The most extreme of which for the heart would be having a heart attack, and for the brain having a stroke. And you can see the pipes, the rusty pipes, as Matt mentioned, all involves with the blood vessels. Why is it important? Well, in Canada and equally on the North Shore, it is the second most common cause of death, just second only to cancer. And so on the North Shore, 24% of deaths are caused by cardiovascular disease. And it increases in frequency, of course, as with many things as we age. So it's even more important as we get older to understand the causes and what we can do about it. The common risk factors for cardiovascular disease, the biggest one is probably genetics, but of course you can't pick your family. But it is really, really important that you talk to your family doctor about your family history. And that might change. Like you might have been seeing your family doctor for 20 years, but you haven't told them that recently your sister or your brother or somebody close in your family has had a heart attack or a stroke, and that's really important information for your family doctor. So always update that information. You might not remember to tell them, but that's really, really important. Smoking is probably higher than any of the other risk factors. 2 to 5 times higher of a risk for developing cardiovascular disease if you smoke. And so that's kind of the number one thing. If you smoke, you want to really work at trying to quit smoking. We're lucky on the North Shore. There's not as many smokers as in some areas in Canada, but it's really important, and there's a lot of help for smoking available. There's free medications, the patches, so you can talk to your family doctor, your pharmacist about that, and keep working on it. I think we're going to do questions at the end if that's okay, so write it down, don't forget. And then the other ones, high blood pressure, cholesterol, and diabetes, those are things you might not, you smoke, right? If you smoke, but you might not know that you've got high cholesterol or high blood pressure or diabetes. So those are things that are important to find out because it makes a real difference. We'll start first with high blood pressure. Um, and, what is it? It's pressure in the pipes. If you have a normal, healthy artery, it's sort of soft, supple, wide, and things flow through it easily. If you have hypertension, the blood vessels tend to get narrower, stiffer, and you need more pressure to push things through. Think of trying to push a milkshake through a straw. And if it's a nice big straw, it's easy and there's not much pressure. But if you've got a narrow, thick straw, then it's harder to push that milkshake through there. Why care about it? Well, as you know, high blood pressure can lead to all kinds of different effects in the body, including stroke, vision loss. That pressure on the heart can lead to heart failure, heart attack, kidney disease. An important one is sexual dysfunction, erectile dysfunction. Sometimes people don't want to talk about it, but it's really important to talk to your family doctor about that because if you do have erectile dysfunction, that can be an early sign of cardiovascular disease. So that's important to let your family doctor know or your nurse practitioner know that. It can be a little hard to diagnose and sort out sometimes. So let's do the basics first. What are the numbers? You probably know this already, but the top number is the systolic, which is also called the systolic blood pressure, is the blood pressure when the heart is squeezing. And the diastolic, the lower number, is the one when the heart is relaxed. And they're both important. I remember years ago, a lot of people thought, oh, only the top number is important, the systolic, but it's actually both. And it can be difficult to diagnose. It's never diagnosed with one reading alone. Blood pressure is all over the map for many people, and you're trying to figure out what that person's average blood pressure is. So it's never, you have to have multiple readings over time to sort it out. Never get panicked if you have a high blood pressure. If you take it and it's really high, always relax, take it again. Don't get fussed about it. High blood pressure is a long-term game. It's something that affects your system over years. And so don't get too fussed if it's high for a few days or you're more thinking about what's your average over a long period of time because that's what causes the complications. The thresholds, for most people, it's 140 over 90, but there's all kinds of things that change the goalposts for all of these, whether it's diabetes, cholesterol, or high blood pressure. So you have to talk to your family doctor about what are your numbers? What's the best? Where should you be? So don't go by what your friend says your blood pressure should be. You need to go by what your doctor says your blood pressure should be because it's different for everybody. Taking your blood pressure. We do a terrible job of this in the doctor's office, right? You're sitting there and you're talking to the doctor and they're taking your blood pressure and, it can be not very accurate. Often it's better to buy your own cuff and take it at home where you can control these and you can control the situation and you can get much better readings. I think Walmart has blood pressure cuffs for around $60, so it's not a bad investment because you want to get this right. The way to take your blood pressure, you want to be sitting in a chair, feet on the ground, back supported. Don't have your legs crossed. I've done that in the office where I've had people uncross their legs, and it makes at least a 10-point difference. It's amazing. And talking also makes a big difference. Make sure you're not stressed. Make sure you haven't just had a cup of coffee. If your bladder's full, if you're rushing around, wait. You want to have, and because when they're making these, the studies that look at what level should we have your blood pressure at to improve your health outcomes, that's how they're doing the blood pressure, right? So you really want to optimize it. Treatment and prevention of hypertension, lifestyle factors. We're going to be getting all day long, you're going to be getting lifestyle factors, right? Exercise, more exercise. Medications is there because they work well, but you can also, take some of this into your own control. And so tobacco, again, if you smoke, try and keep working on quitting smoking. Nutrition, there's something called the DASH diet, which has been known to be helpful. That's going to be in the resource sheet for you. And it includes a little bit of dairy as well as kind of that Mediterranean diet of not too much red meat, not too much processed foods. For nutrition, often little things make a big difference. So if you eat out a lot, or if you buy pre-packaged foods in, boxes, cans, whatever, read the label, see how much salt is in there, and if you can even cut down a little bit on that, it makes a big difference. Same with physical activity. You don't need to be doing a ton of stuff. Just a little bit makes a big difference. Start small. Talk to your doctor about it. What's right for you, but it doesn't have to be a lot. Obesity is that kind of weight that's around the middle of your waist. That's the weight that seems to be bad for your system. It causes a lot of inflammation. So even reducing that a little bit makes a big difference. We'll move on to diabetes. We'll go through this pretty fast. So diabetes is when the body cannot even either produce insulin, which is type 1 diabetes, or if the body is not using insulin properly, type 2. And that's the big one. That's 85 to 90% of diabetes in Canada is type 2 diabetes. So insulin regulates your blood sugar. It helps get the blood sugar out of your arteries and into your tissues. If it stays there, it can cause inflammation, irritation, problems with the blood vessels. So you want to get it out of there and into your muscles. Prediabetes is also an important condition to know about because type 2 diabetes causes a lot of complications. And you can also see that a little bit in prediabetes as well. And that is when you don't quite qualify for diabetes, but your numbers are still a little bit high. I'll talk about that a little bit more. And it's so important because 25% of the people in that zone where they're not quite diabetic, but their numbers are getting close, will go on to become diabetic. But this is the stage where you can prevent it from becoming diabetes by doing lifestyle changes, exercise, diet. So you get a lot of bang for your buck if you catch it in this particular zone. So what is that? A1C is a blood test. So that's how you diagnose diabetes, by either fasting blood sugar or A1C, which measures the amount of sugar attached to a hemoglobin molecule. So it's a little bit of a better reading because it measures an average over the last 2 to 3 months. And if you're over 6.5, then you're diabetic. If you are above 6, between 6 and 6.4, then that's considered pre-diabetes. In the States and some other countries, it's 5.5, 5.7. So if you're in the high 5s or low 6s, then you might want to be looking at making some lifestyle changes so that you don't go on to develop diabetes. So it's a really important number. Matt's probably going to talk about this more, but know your numbers. It's very empowering to know where you're at. Once you're diagnosed with diabetes, to prevent complications, it's been well shown that keeping your numbers low makes a difference for developing complications of diabetes. For most people, that's going to be trying to keep that A1C 7 or less. But if if you want to balance that, if you've got somebody that's quite frail or might have trouble with medications, sometimes a little bit more is allowed. So again, you want to know what your number is, and then you want to know what your doctor's goalposts are for you. So that's another thing to ask, where should I be keeping my A1C? Because that'll be different for everybody. The complications of diabetes, probably most of you know that, stroke, eye damage. So people with diabetes should be getting their eyes checked at least yearly. Yeah, that could be an ophthalmologist or an optometrist. Over 65, optometry is covered for a visit a year. Kidney damage, heart disease, peripheral neuropathy is important because often people don't realize that they have it. It's when the nerves in your feet get affected and you have less sensation. And so sometimes you're not aware of it, and that can lead to diabetic foot, which is if you get a cut or something, you don't know that it's there. And so it can develop into an ulcer or something nasty. That's when you hear about people getting toes amputated, and that's because they don't know, they can't feel it. So again, if you've got diabetes, you should be checked once a year at your family doctors or your specialist for peripheral neuropathy to see if you have it. And if you do have it, then you need to be checking your feet daily just to make sure that you don't have anything there. You have to look at it, look at the bottom of your feet, make sure there's nothing there. Managing diabetes gets back to the same things, healthy eating, diabetic diet, and again, when you're starting on that, especially in your pre-diabetic zone, it doesn't have to be huge. Small changes can make a difference. Stopping all pop, like all sugared pop. I've had patients where just doing that got them out of that pre-diabetic zone and back into a normal blood sugar. A lot of times with diabetes, you'll get your A1C monitored every 3 months just to make sure that things are okay. Medications, and because it's complicated and can have a lot of ramifications in different parts of the body, it is important to see your family doctor or nurse practitioner regularly for monitoring. The last one is cholesterol. So most of you probably had your cholesterol checked. If you haven't, again, you should know your numbers so you know where you're at. It's, and you probably know that when you get a cholesterol done, you get a bunch of different numbers. The important ones, they give you a few different things, but the important ones are the HDL and the LDL. Cholesterol is important. It's important for cell growth. Everybody has to have some in their body. But if you have too much of the LDL type, that can start leading to plaque formation in the arteries and hardening of the arteries, otherwise atherosclerosis. The HDL is your friend. It's the good cholesterol, and I liken it to, it goes around and it mops up the bad cholesterol. So that ratio is really important as well. How do you know if you've got high cholesterol? Again, you can't feel it. So the only way is to get a blood test done. And I didn't even go into the targets on that one because, again, it's so different depending on your particular risk factors, very highly individualized. So if you have, a family history of heart disease, or if you have diabetes, if you've had a heart attack in the past, your goals are going to be different for what your cholesterol should be. So you need to know what your number is and also what your target is. Again, managing cholesterol diet as always. You've probably heard of the Mediterranean diet, which very little red meat, not very much saturated fat. But there's often things with diet where, again, little things will make a huge difference. Like people say they didn't know that sausages were really bad for them, or bacon was really bad for them. Shrimp, really love shrimp, but they're not good for your cholesterol. Um, so um, again, making it doesn't have to be this huge thing. For a lot of people, just making some small changes can make a big difference. Looking at diet, there's lots of information sheets. Again, that's on the resource sheet as well. And you can just look at it and go, oh, I didn't know that. I didn't know that was bad for my cholesterol. And sometimes just cutting out a few things makes a difference. Um, Exercise is interesting because it's one of that HDL, that good cholesterol. Medication doesn't do anything for that. But exercise does. It can increase that HDL. So if you want to get that balance of the stuff mopping up the bad cholesterol, exercise is the way to go for that. And again, it doesn't have to be a huge amount. Um, um, Limiting alcohol, important for all these risk factors because it can improve hypertension, diabetes, and cholesterol. The new guidelines are, as you know, hardly anything. But again, like with the diet, sometimes just a little bit less, taking a couple of days off a week if you're a daily drinker, giving that liver a little bit of a rest. It doesn't have to be nothing at all necessarily, but making some changes. So that was a real quick run through of different factors for cardiovascular disease. Um, most of these things can be made better with things that you can do. It doesn't have to be medication. It can be small changes. Like for diabetes, I love to tell people a little thing that you can do is after you eat, get up and move because that gets that sugar into your muscles. So even if it's just going up and down your apartment corridor, going around the block, especially after whatever your biggest meal of the day is, it doesn't have to be going to the gym for an hour. Just going for a little walk after a meal makes a huge difference. Um, I want to mention adjusting medications when you're sick. A lot of people don't know this, and I've seen this happen many times where if you're on any kind of medication, but especially diabetes and hypertension medications, and you're sick, make sure you've got a plan. Make sure you've talked to your family doctor about what do I do if I'm sick and I'm throwing up and I can't, eat or drink for a couple of days. Because in a lot of those cases, you don't want to be taking your medication because if you get dehydrated, low blood pressure, that can be really hard on your kidneys. And I've seen people have kidney damage from that. So a question to ask with medication is always, what do I do if I'm sick? Are there any circumstances where I shouldn't be taking this medication? Don't just blindly keep taking um, um, just in case. Know your numbers. That's Matt saying, and it's important. Know what your cholesterol is. Know what your blood sugar is. Know what your blood pressure is, and also know what your goalposts are, what your doctor thinks that where you should be, because it'll be different for everybody. Never too late to reduce your risk. It makes a difference at any stage. Exercise, diet, quitting smoking, it doesn't matter. It always makes a difference. And work with your primary care provider. That's what we're here to do, just to help you sort those things out because it is complicated. And like I said, there's resource sheets at the back of the table back there. So that's just what that looks like. And also it'll be available on the website. A great resource that I love is HealthLink BC. You go to the website HealthLink BC and type in any topic. They have short, practical um, advice on just about everything that you could possibly think of, any health-related issue, and very well written, and I find that a really good resource for anything. So I think that's my part of the blah, blah, blah talk, and now it's your turn.